Small bowel capsule endoscopy and device-assisted enteroscopy for diagnosis and treatment of small bowel disorders. European Society of Gastrointestinal Endoscopy, ESGE Guideline, Update 2022. Introduction. The introduction of small bowel capsule endoscopy and device-assisted endoscopy over 20 years ago marked the beginning of a new era for investigating the small intestine. There is now more solid scientific evidence on established indications, and more data on new applications of enteroscopy are available. The aim of this guideline, commissioned by the European Society of Gastrointestinal Endoscopy as an update of the previous 2015 guideline, is to provide guidance for the clinical application of enteroscopy techniques in the management of adult patients with small bowel disorders. Main recommendations. ESGE recommends small bowel capsule endoscopy as the first-line examination before consideration of other endoscopic and radiological diagnostic tests for suspected small bowel bleeding, given the excellent safety profile of capsule endoscopy, its patient tolerability, and its potential to visualize the entire small bowel mucosa. Strong recommendation, moderate quality evidence. ESGE recommends small bowel capsule endoscopy in patients with overt suspected small bowel bleeding as soon as possible after the bleeding episode, ideally within 48 hours, to maximize the diagnostic and subsequent therapeutic yield. Strong recommendation, high-quality evidence. ESGE does not recommend routine second-look endoscopy prior to small bowel capsule endoscopy in patients with suspected small bowel bleeding or iron-deficiency anemia. Strong recommendation, low-quality evidence. ESGE recommends conservative management in those patients with suspected small bowel bleeding and high-quality negative small bowel capsule endoscopy. Strong recommendation, moderate quality evidence. ESGE recommends device-assisted enteroscopy to confirm and possibly treat lesions identified by small bowel capsule endoscopy. Strong recommendation, high-quality evidence. ESGE recommends the performance of small bowel capsule endoscopy as a first-line examination in patients with iron-deficiency anemia when small bowel evaluation is indicated. Strong recommendation, high-quality evidence. ESGE recommends small bowel capsule endoscopy in patients with suspected Crohn's disease and negative ileocolonoscopy findings as the initial diagnostic modality for investigating the small bowel in the absence of obstructive symptoms or known bowel stenosis. Strong recommendation, high-quality evidence. ESGE recommends in patients with unremarkable or non-diagnostic findings from dedicated small bowel cross-sectional imaging, small bowel capsule endoscopy as a subsequent investigation if deemed likely to influence patient management. Strong recommendation, low-quality evidence. ESGE recommends in patients with established Crohn's disease the use of a patency capsule before small bowel capsule endoscopy to decrease the capsule retention rate. Strong recommendation, moderate quality evidence. ESGE recommends device-assisted enteroscopy as an alternative to surgery for foreign bodies retained in the small bowel requiring retrieval in patients without acute intestinal obstruction. Strong recommendation, moderate quality evidence. ESGE recommends device-assisted enteroscopy endoscopic retrograde cholangiopancreatography as a first-line endoscopic approach to treat pancreaticobiliary diseases in patients with surgically altered anatomy, except for Billroth 2 patients. Strong recommendation, moderate quality evidence.